Hello everyone! I would like to welcome at my presentation. Let me introduce myself. I'm Borisienko Natali and I'm second year student of Ural State Medical University. My scientific supervisor is Елена Фахаргалеевна Гайсина. I'm going to speak about the problem of antibiotic prevention of infective endocarditis in dentistry. First of all, I would like to tell about some general information about infective endocarditis and there we go to research. So, infective endocarditis is a severe inflammatory disease of the endocardium predominantly affecting the heart valves, walls of the heart, arterial walls and ventricles. The etiological factors of infective endocarditis include Streptococcus viridans and Streptococcus bovis, Staphylococcus aureus, Enterococci, and bacteria of the Hayes group. To illustrate this, let's have a closer look at the materials and research methods. The research was conducted using the following scientific electronic libraries: Cochrane Library, PubMed, and ResearchGate. Also, a survey and analytical study of the literature data was carried out. There are inclusion criteria. Full-text publications are registered between 2020 and 2023. The main purpose of the study is analysis of literature on the problem of antibiotic prevention of infective endocarditis in dentistry. Let's move to another important topic, which is research results. In general, antimicrobials are considered effective. This is according to the European Society of Cardiology treatment guidelines for infective endocarditis in 2015. One of the main problems in the prevention of infective endocarditis is bacterial resistance to antibiotics. For example, Aminoglycositis. The indications and pattern of use of Aminoglycositis have changed. They are no longer recommended in staphylococcal native valve endocarditis because their clinical benefits have not been demonstrated, but they can increase renal toxicity. When they are indicated in other conditions, aminoglycositis should be given in a single daily dose to reduce nephrotoxicity. In cases of streptococcal infective endocarditis, treatment with aminoglycositis is carried out for at least 2 weeks. Short-term treatment is not recommended. I would like to draw your attention to antibiotics used in Sweden and Saudi Arabia. In Sweden, amoxicillin are recommended as prevention for infective endocarditis in oral surgery. Patients with prosthetic valves are given 2 grams of amoxicillin orally 1 hour before invasive dental procedures. In Saudi Arabia, this antibiotics is most commonly used for infective endocarditis. On your screens, you can see the table describing amoxicillin used for beta-lactam strains. Let me give you a brief overview of prophylaxis dental procedures. There are 2 situations for high-risk dental procedures in high-risk patients. If patient has no allergy to penicillin or ampicillin, amoxicillin and ampicillin can be prescribed. You can see a dose for adults and children. In case patient has allergy, clindamycin can be used. Dramycin is an antibiotic approved for Streptococcus aureus, bacteremia and right-sided infective endocarditis. Dramycin is used as alternative therapy. Dramycin is administered in combination with fosfomycin at high doses. In the next slide, you will find information for antibiotic prevention of infective endocarditis in Russia. Doctors prescribe 6 grams Cefazillin once a day intramuscularly or intravenously for patients at high risk of infective endocarditis in the absence of anaphylactic allergy. 12 grams oxacillin intravenously 4 times a day in case of infective endocarditis of prosthetic valves. This brings to the end of my presentation. I would like to highlight one more time the problem of antibiotic prevention of infective endocarditis. The list of antibacterial agents and broad-spectrum antibiotics is presented on the slide. Further clinical studies need to be conducted regarding for discussion of antibiotic prevention of infective endocarditis. Thanks for your attention.